Why is my stomach still big after pregnancy?
I'm assuming you didn't take advantage of the adage of eating for two and gain way more than 20 pounds.
I think you're allowed to gain 40 over the course of a pregnancy.
Of which 10 is expected to be the baby, 10 of which is blood and bodily fluids. And the rest ends up as padding on all your curves, though hopefully not creating new ones.
It's pretty much just my stomach that's big.
Remember that your belly was pretty big before you unloaded. It normally takes a few months for things to flatten back up after you have the baby. And even after that, it probably won't go back to the six-pack abs you may have had before.
Forget about six-pack abs. I'll settle for having a 24-pack.
So if the kid is still wearing newborn diapers, do not worry about the big stomach as long as things are still loose.
They said the skin should shrink back as you nurse.
While breast is best, there are way too many people who promise the moon for going all natural with breastfeeding.
Does that mean breastfeeding won't make my stomach flatter?
Yes, it shrinks your stomach a little faster and might help you lose weight if you do not eat for two after having the baby. No, it won't make a stretched out balloon back to its original shape, or undo the effects of a bad diet.
I have not been eating that bad of a diet.
If you had a normal delivery and things are still poochy after a few weeks, go talk to your doctor.
I already have follow-ups.
I think somewhere between 1 in 10 to 1 in 20 women used to die in childbirth before the advent of proper hygiene and antibiotics. You could have an infection, causing swelling.
I know it was stressful. Now I get the analogy of squeezing a bowling ball through a straw.
For some women who had cesareans, the surgical scars can alter the lay of the stomach, but that all depends on the circumstances.
This was the standard legs in stirrups delivery.
Then unless it is an infection, expect it to take about as long as it did to stretch out to accommodate the baby to shrink back toward your old size.
The only consolation is that I keep the bigger boobs.
They'll be a little smaller than they are now when you finish breastfeeding. And the wider hips, which expanded to accommodate the baby, are permanent too.
Unfortunately, the doctor says the wider feet are too.
I see nothing wrong with having an excuse for new shoe shopping,